Doctors, what's the worst case you've encountered in a patient that another doctor completely overlooked? Broken neck. No, really. So this one man was brought in by ambulance with an upper airway obstruction. We diagnosed what appeared to be advanced throat cancer and performed a tracheostomy. After the operation, during which the neck is pulled and pushed quite a bit, we reviewed his post-operative neck x-ray, and a junior doctor asked when he had fractured his neck. He had a brand new, unstable neck fracture. When we checked his initial x-ray, we saw that it had been present before the operation. After questioning the patient, he explained that on the way to the hospital, the ambulance had been in a car crash. No one mentioned it to us when he arrived. He assumed he only had some whiplash, but he had been just a few millimeters away from permanent paraplegia. Unfortunately, he passed away about 2 weeks later due to the cancer. Story 2. Rattlesnake bite on a 2-year-old. The patient and her father were out in the fields near a small town several hours from the nearest major city where I work. The father took the child to the local ER where she had an obvious snake bite. The doctor there said, it's okay, she probably wasn't envenomated. They did not administer antivenin, which was available at that hospital, and instead of sending the child by helicopter, they sent her by ambulance. Several hours later, she arrived at our hospital in cardiac arrest and ultimately died. Probably wasn't envenomated? What kind of reckless thinking is that? If a tiny child is bitten by a rattlesnake, you assume envenomation and treat accordingly, with antivenin, physiological support, and close monitoring. It was completely absurd and tragic. Story 3. While I was pregnant with my youngest, I suffered severe acid reflux. I lost 20 to 30 pounds because I couldn't keep anything down, not even water, and would frequently cry and vomit. Near the end of my pregnancy, I was hospitalized for dehydration. My nurse practitioner at the time told me I was overreacting and claimed it was good for me to lose weight because I was too big anyway. I understand I'm not skinny, but I was not morbidly obese. After giving birth, the reflux did not improve, as I had been told it would. I took antacids constantly, but I still couldn't keep anything down and spent a lot of time crying. One night, my symptoms were especially severe. I was vomiting blood, and the taste and smell in my mouth were horrendous. I tried not to cry as I made my way to the hospital again. The doctor there asked, "Weren't you here a few months ago?" Of course, I said yes. I received a shot of gravel in the hip, but it didn't help. They tried another medication, but still nothing improved. By this point, the doctor realized, okay, she's not pregnant anymore, so what's going on? A surgeon was called, who ordered x-rays. They discovered that my gallbladder was severely inflamed and could not be saved. She prescribed a series of medications, finally believing how much pain I was in. It took a week for the swelling to reduce enough to allow surgery. I am so grateful to this surgeon for finally taking my condition seriously. Story 4. I work in EMS. We received a call for a woman with leg pain. When we arrived, her leg was 3 times the size of the other one, blue and purple, and there was no pulse in her foot. She had fallen on ice a few days earlier, and the urgent care she went to hadn't done any x-rays. They told her it was a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured that they were cutting the blood vessels and muscle tissue. She ultimately lost her foot. Story 5. I'm not a doctor. I'm a nurse, but not in med-surg. My sister had her gallbladder removed in a routine surgery, and 2 days later she woke up at 4 a.m. in searing pain and went to the ER by ambulance. I met her there. The ER doctors apparently assumed she was a drug seeker and didn't conduct a proper physical exam beyond taking her vitals. They tried to dismiss her as she kept yelling, help me, I'm dying." They eventually did an MRI, which they said was negative, and sent her home. She didn't want to leave and insisted something was terribly wrong, but they threatened to call security and have her removed. At this point, it's important to note that she had no history of drug or alcohol abuse. She continued to get worse at home, and the next day went to a different hospital. They did a full workup and discovered that the metal clip used to close off her bile duct had cut through the tissue, causing a large bile leak that was literally burning her abdominal organs. She had to undergo 3 surgeries to fix it and was hospitalized for 9 days. She was left with chronic pain from adhesions and chemical burns. When the new hospital finally obtained the MRI from the original ER visit, she was told that the leak was small but clearly visible on that image. Story 6. Another not a doctor story. My mother-in-law showed all the signs of a stroke: severe headache, vomiting, vertigo, vision problems, and partial paralysis, but was sent home from the emergency room and told it was an inner ear condition that would resolve on its own. When she did not improve, she saw her GP, who, upon simply looking at her, asked when she had had the stroke. Realizing it was still untreated, he immediately sent her back to the hospital. There, they finally recognized that she had suffered a major stroke. She could easily have died and spent weeks in rehab. The hospital then claimed it must have happened after her first visit because, unbelievably, her chart from that visit did not note that she had had a stroke. A statement so wrong, it's hard to know where to begin. Story 7. I'm a doctor, and you would be surprised at how much ineptitude exists, even among our ranks. I once had a new overnight admission who had been admitted by another doctor the evening before. The patient had clearly suffered an out-of-hospital cardiac arrest at a local casino, with a defibrillator used to achieve return of spontaneous circulation. The admitting doctor documented it as syncope or fainting and had ordered a cardiac stress test for the following morning. I recognized the severity early that morning. The patient ended up needing emergency cardiac catheterization and a stent for a heart artery that had caused the cardiac arrest. If the admitting doctor had proceeded with the stress test, it could have been fatal. I have literally dozens of stories like this. It feels like half the doctors I work with are incompetent or indifferent. Edit. I want to clarify and defend doctors as well. Medicine is incredibly difficult. The more you learn, the more you realize there is to learn, and you are never truly confident that you know enough. Modern medicine has limitations, and sometimes we simply don't know. Most doctors are genuinely trying their best, so I don't want to unfairly criticize the profession. The healthcare system in the United States is also deeply flawed, and these issues are due to both systemic problems and individual practitioners. Story 8. A patient came into our ICU severely septic but still talking. He had visited his primary care physician a few days earlier with complaints of a sore throat. The doctor had dismissed him without intervention, as it didn't appear to be strep throat or the flu. By the time he arrived at the ICU, he was experiencing significant abdominal discomfort, so we sent him for a CT scan. As the scan was finishing, he coded and had to be intubated. He developed multi-organ failure. The CT scan revealed catastrophic findings. His peritoneal cavity was filled with widespread infection and debris. His wife told us that he had choked on an ice cube the day before seeing his primary care physician. He had swallowed a whole double half-moon-shaped ice cube, which perforated his esophagus with a massive 4¼ inch linear tear. This allowed a significant portion of his swallowed food and drinks to enter his peritoneal cavity instead of his stomach. To make matters worse, he also had reflux, which likely allowed stomach acid to enter the peritoneal cavity while he was sleeping. Once we understood the cause, he underwent extensive washout and exploratory surgeries to repair the damage to his esophagus and other organs. Thankfully, he made a full recovery, though he had been extremely close to not surviving. Story 9. During my residency, we cared for a woman in her 60s who was becoming progressively more forgetful and increasingly unable to take care of herself. Her primary care physician had diagnosed her with dementia, and a neurologist agreed. She could not provide an accurate history herself, but after speaking with her family and friends, it became clear that her symptoms were progressing unusually quickly. I remember noticing the contrast between her new hair growth and bright red dye, as well as her grown-out nails with hot pink polish, realizing it had not been long since she was independently maintaining her appearance. The woman in front of me was far from that level of independence. The neurologist I was training with recognized this, had her admitted, and ordered a full workup, including a lumbar puncture. Testing eventually revealed Creutzfeldt-Jakob disease, a rare and untreatable condition. She passed away a few months later, but at least her family was able to prepare for her continued decline and make necessary arrangements. It was a deeply sad situation. Story 10. I was working nights when a patient came in for a nail bed repair under general anesthesia. It was a slow night. As he was being anesthetized, he aspirated, so we did a chest x-ray to check for fluid or blood in his lungs. What we didn't know was that prior to this emergency surgery, he had been seeing his GP for over 6 months about chest tightness. He had been put on various asthma medications, none of which helped. The x-ray revealed a massive dark mass in his left lung. We kept him sedated and transferred him to the ICU. His wife and 3-year-old daughter were waiting on the ward. We had to explain where he had gone, why he had gone there, and what was going to happen. He died from lung cancer within the month. Edit. A general anesthetic was overkill for a nail bed repair, but he refused to have it done under local anesthetic. A commenter below correctly pointed out, and after discussing with a colleague, I learned that the dark area on the X-ray was actually normal lung, while the rest was whited out because it was riddled with tumors. This man was in his late 20s, a non-smoker, and I couldn't get past the situation for months afterward. Story 11. A patient presented with stroke-like symptoms, weakness on one side, blurred vision, and extremely high blood pressure. He worked at the hospital and told his manager how he was feeling and was directed to occupational health and safety. There, he was told, "You're fine, go to a walk-in clinic after work." He returned to work, but fortunately his manager insisted, "Nope, go to the ER." Once he arrived, a stat-head CT revealed a current intracranial infarct and 3 old infarcts that had never been diagnosed, 4 strokes in total. And yet, earlier, he had been told he was fine and could just go to a walk-in clinic after work. Wow. Story 12. During my training, I saw a 4-year-old child suspected of having meningitis. Although I was new to pediatric medicine, I had a gut feeling that the child was far too ill for a routine viral illness. What tipped me off was a slight delay in the pupillary reflexes. I asked the head pediatrician to perform a lumbar puncture to check the spinal fluid for signs of infection. She insisted it was unnecessary and suggested all symptoms pointed to a common airborne virus circulating at the time. I knew an unnecessary lumbar puncture could scar a child, and while I disagreed, I doubted my own judgment and assumed that a doctor with tens of thousands of hours of experience surely knew better than me. I shrugged, documented everything in the dossier, and asked the pediatrician to review my evaluation afterward. I went home after an exhausting evening, having worked almost 14 hours straight. 3 days later, the child returned with fulminant meningitis that had rapidly worsened. When discussing the patient, the pediatrician noted the same abnormal pupillary reflexes I had observed. Not only had she dismissed my suggestion of a diagnostic lumbar puncture, but she also had not read my evaluation from 3 days earlier. I learned to never doubt my gut instincts, a lesson that has sometimes led me to outlandish diagnoses, but has saved patients more than once. Story 13. Speaking on behalf of my ER nurse, who reasonably freaked out and put me in quarantine, meningitis. I had been dealing with migraines for the past couple of months, and they were steadily getting worse. Around the halfway point, I couldn't go to work anymore. All I could do was lie in bed, moaning, in pain. I went to an urgent care doctor who told me it was the flu. This prick had the audacity to listen to my story about being bedridden with increasingly severe migraines, swab me for the flu, have the test fail, and still insist it was probably the flu and that I just needed to drink more water. Fast forward to the next weekend. I went into the ER. The nurse looked me up and down, listened to my story, and asked if my neck was stiff. I said yes, and while he kept his composure, he freaked out when I got weirded out about the possibility of inpatient care. I signed off when I was finally able to catch my breath for a moment. The guy was trying to stress how important it was that I sign off immediately, but I don't handle pressure well, so he escalated and told me I was in imminent danger, and that anyone I'd been in contact with was as well. That didn't help. I just panicked more. But once I managed to convince him that I literally needed about 5 minutes to breathe and process, everything settled and I signed in. They did the thing where they take brainstem fluid from your back to figure out which variant I had, put me in a quarantined room, and I stayed there for 2 weeks. If you're as unfamiliar with the disease as I was, it has 2 different variants. One can kill you and is a serious problem, and one is usually not. It got to the point where I couldn't answer basic questions about what I did at work. Work actually called, because I was the only person who knew how to handle something. But luckily, my boss is a smart guy and pieced it together himself. Fortunately, I ended up having a severe case of the variant that doesn't kill you. I was out of commission for 2 months straight and couldn't even look at a computer screen without getting instantly nauseous. So, yeah. If that urgent care doctor is out there, you really messed up and caused one of the scariest moments of my life. Maybe don't do that to other people. Story 14. During my psychiatry residency, I was working in the psych ER one night when we received a transfer from the main ER. Her family had brought her in for altered mental status that had been getting gradually worse over the past 2 weeks. She had been cleared by the ER doctors. All her labs and vitals were normal, and I was told she was likely having a mental breakdown or a psychotic episode. She was rolled into our area and I went to assess her. She was non-responsive, staring into space, crying, shaking her head back and forth, and mumbling. She couldn't answer any questions and seemed to be in tremendous distress. As a psychiatrist, one of the biggest lessons my mentors taught us was to assume that a change in mental status is always a medical condition until proven otherwise. Only then do you start considering psychiatric causes. Within a couple of seconds of seeing her, I had a gut feeling this was not psychiatric in nature. I looked through her chart and saw she had a history of blood clots. Her vitals were rechecked and, again, completely normal. At that point, I made an executive decision and ordered a stat CT of her chest to look for a possible clot. The technicians who came to take her for the study were a bit confused as to why a psych resident was ordering it, and the radiology team even called to confirm I hadn't placed the order by mistake. 30 minutes later, I got a call from the on-call radiology resident. She asked, "Are you the psych resident who ordered this CT?" "Yep, that's me," I said, expecting a comment about wasting their time. Instead, she continued, "And this patient is in the psych ER?" "Yes." "Well, you'd better call the ER and have her transferred stat, because this lady has the most massive pulmonary embolism I have ever seen and will likely code any second." With that, we transferred her back to the ER. She was admitted to the hospital and treated for the clot, and within a few days, she was back to normal. After that, whenever someone made a joke about psychiatrists not being real doctors, I would tell them this story, and that usually settled it. Story 15. I fell down the stairs because of ice and basically hit every step on the way down with my lower back. I went to the doctor a little while later because the pain didn't go away, and he told me it was just bruising and gave me 1,000 milligrams of ibuprofen. A year later, I went back because the pain had gotten worse and I had started walking with a cane since my legs were hurting a lot too. After a referral for an MRI, I found out I had 3 herniated discs in my lower back. I had surgery about 3 months later. I still needed the cane, but the pain was more manageable. 2 years later, I started working for a nationwide secondhand store and ended up back at the doctor because even walking through a grocery store had become unbearably painful. He assumed I was a drug seeker and only gave me steroids. I went to another doctor, and for almost 3 years, he would only treat my blood pressure and nothing else. Finally, when the company I was working for was shutting down, I found a doctor who actually helped me push through everything. While my insurance was still active, I got another back surgery for what had become 4 herniated discs. I no longer walk with a cane and have been mostly pain-free for 2 years. Story 16. Last year, I had pretty constant stomach pain. I'm fairly fit and active, eat reasonably healthy, and I'm 26, so the doctor said it was probably nothing and gave me acid reflux medication, which confused me because the pain was clearly in my lower abdomen. I was in and out of the hospital with this nonstop pain and it was wearing me down. I'm usually super chipper and a happy-go-lucky kind of guy, and when I stopped feeling like myself, I knew it wasn't nothing. They ran a ton of blood tests and still couldn't find an answer. I would wake up after barely sleeping and think, I'll have a single piece of toast. I've eaten toast my whole life. It can't be that. And then spend the entire day feeling awful. The stomach pain was terrible. Just relentless. I remember breaking down at one point, completely lost, because they kept saying, "Nothing's wrong. We can't tell. Your blood is fine." So my doctor suggested a colonoscopy, just to make sure it wasn't colon cancer or anything. As they were putting me under for the procedure, the attending doctor said, "Hey, I noticed something on your blood work. We're going to take a biopsy of your upper intestine as well, but we'll have to go through your mouth." I was already fading out as he said it. So they sent a scope down my throat and another up the back door, so to speak. 3 weeks later, it turned out I had celiac disease. After drinking beer and eating bread my whole life, it just switched on one day. I'm glad that doctor took the upper intestine biopsy because it wasn't showing up on the blood work. My digestive tract and blood looked just fine, but my upper intestine was severely scarred from celiac disease, and I had no idea. It had started to block proper nutrient absorption, so without that biopsy, I probably would have ended up in the emergency room a few weeks later with scurvy. Wild stuff, and honestly, the best case scenario because my treatment is simply don't eat wheat. I have to admit, Already being lactose intolerant, that was kind of a rough thing to hear, but what can you do? It could have been much worse, though it definitely wasn't fun to deal with during COVID times, and on my own. Story 17, the patient was lactating despite not being pregnant or breastfeeding. Her previous doctor told her it was residual from her baby, who had been weaned for 14 months. I sent her for a brain scan immediately, and it turned out to be a brain tumor. She had surgery 1 week later to remove it and is doing very well now. Edit. She left my office with a referral for an MRI and a referral to an endocrinologist who took over her care. Also, please, if you are concerned about your health in any way, or are not satisfied with your doctor or your care, obtain your medical records and bring them to a different doctor. Do not seek medical advice from strangers on the internet who know nothing about your medical history. That can be very dangerous to your health. Story 18. My husband had a strange dimpled spot on his back. He went to the dermatologist multiple times and was brushed off, told not to worry about it. The dermatologist even burned off a nodule near his belt line that was bothering him, but kept insisting it was nothing, and was visibly irritated with us for being anxious. Because the experience was so negative, we waited nearly 10 years before seeing another dermatologist. The new dermatologist immediately diagnosed what turned out to be a sarcoma that had been growing for those 10 extra years. My husband now has a 48-inch scar running down his back from the tumor removal and the reshaping of his back. I now have months of experience dealing with wound drains, tunneling, bandages, triage, and all the laundry that comes with healing a massive wound. I would love to take that first dermatologist, who was so unbelievably patronizing about our concerns, and shove his face straight into his own A. Story 19. I suppose I have one from my time as a resident doctor. We saw a kid in the emergency department for difficulty walking. He had been slowly losing the ability to walk over several months and also had random, unexplained episodes of projectile vomiting. Looking through his records, he had seen his doctor multiple times, who x-rayed one hip, then the other hip, and gave him some Zofran, but that was it. On exam, he was clearly ataxic, terrible coordination, and he couldn't even stand. He failed all of our bedside neurological tests for cerebellar function. It was obvious, and I'm not even that experienced yet. We ordered a CT scan. There was a massive tumor in his cerebellum. It was obstructing fluid drainage in his brain, raising his intracranial pressure, and causing the vomiting. We had to call in the neurosurgeons overnight for an emergency drain, and he went straight to the ICU. Later, he had more surgery to address the tumor. My supervisor actually got pretty emotional about the whole situation. Edit. His history showed that he had declined significantly over the last few days, prompting the emergency visit, so he looked especially bad by the time we saw him. Hard to say what he looked like earlier. To any medical students reading this, 1. Do an exam, and 2. It is okay to cry sometimes. Story 20. My best friend was in her late 20s and had constant stomach irritation. She saw several doctors over nearly 3 years, and they all dismissed her, saying she had irritable bowel syndrome. She tried a new diet every few months, but nothing helped. One day she called me saying she had broken her ribs. She didn't know how it happened, but the pain was severe, and her doctor assumed her ribs must be fractured. Long story short, they weren't fractured. When the pain became unbearable, she went to the emergency room and had a CT scan. It revealed stage 4 colon cancer with 4-inch tumors in her abdomen, compressing her organs and causing the pain. She passed away a few months later. She had been seeing doctors about her symptoms for 3 years. If even one of them had taken her seriously and sent her for a colonoscopy, she might still be alive. It's disturbing, but sadly not surprising, to see so many similar stories. If something feels wrong with your body, trust your instincts and don't ignore it just because a doctor says otherwise. For the record, this was not in the United States. I'm keeping the location private to protect my friend's identity. She comes from a small country and has a sibling who used to be on Reddit. Any doctor could have referred her for a colonoscopy, but it seems it was easier to dismiss her. The cancer may have killed her, but the underlying cause was apathy. Story 21, MD here. I was recently called by a nurse who said a patient's bandages were wet from a little bleeding. The patient had recently had his leg amputated. When we removed the bandages, we found a spurting femoral artery and the patient passed out. He was taken to the operating theater for an emergency procedure. Definitely a close call. Story 22. Once, when I was a medical student on a surgery rotation in trauma, a patient came in after falling on the street and hitting his head. He had apparently fallen earlier that day as well and had been discharged from another hospital when the trauma workup there was negative. During our exam, we noticed his eyes were yellow. Since he couldn't give a clear history and we weren't sure what had happened, we CT scanned his abdomen as part of the trauma workup. His common bile duct was about 3 times normal size, huge enough to drive a truck through. Around that time, his next set of vitals showed a temperature of 103 Fahrenheit. He was floridly septic from ascending cholangitis, which explained why he had been falling. It was a big miss and clearly an emergency. Story 23. There was a recent story at the hospital where I work. A cardiologist in the ER was on a particularly difficult night shift and started feeling lightheaded, dizzy, and fatigued. Given how intense those shifts are, 26 plus hours, sometimes multiple times a week, nobody thought much of it, and he went to catch a quick nap in the staff room. People passed by occasionally, assuming he was just exhausted and letting him rest. Tragically, he had passed away for several hours before anyone realized something was seriously wrong. Story 24. Speaking as a patient. When I was a kid, my eyes hurt, and my dad kept taking me back to the same eye doctor. The doctor insisted the problem was that I wasn't cleaning my contacts properly and kept giving me harsher and harsher chemicals to wash them with. It got to the point where I couldn't fully open my eyes in a lit room, and I hadn't worn contacts for months. Finally, after a year, my mom made my dad take me to a different doctor. He literally met me in the waiting room, looked at my eyes with his naked eye, and said, "You have a raging eye infection." A month of medication cleared the infection, but there was so much scarring and damage that it took 20 years before I could wear contacts again. Story 25. Not a doctor, but actually the patient. I had a doctor prescribe me birth control. While in line to pay for it, I was reading the paperwork and realized that another medication I take daily completely negates the effect of the birth control. I went back to the pharmacist to ask about interactions, and he said I might experience side effects. I asked which ones, and he said, pregnancy. Pregnancy is not a side effect. It's a lifelong commitment. Then I called the doctor and asked why she would prescribe something she knew wouldn't work. She said, "But you asked for birth control." Yes, I did, but I wanted one that would actually work. Silly me for not specifying. Story 26. Probably the worst story one can hear. My wife found a lump under her breast that was very concerning. It took about 2 months to get a proper appointment. The doctor diagnosed it as a cyst and fibroadenoma. She drained the lump and it seemed fine, but it grew back a week later and was larger. After weeks of ongoing pain, the doctor finally said this approach wasn't working and scheduled surgery to remove it. When she went in for the checkup, expecting them to just examine the scar and healing, it turned out she had stage 2A triple-negative breast cancer. The surgeon was absolutely floored. The most upsetting part was that while her main surgeon and gynecologist, who had been fantastic, was on holiday, another male doctor told her, "Any surgery would be merely cosmetic, and it clearly doesn't bother you because I can touch the lump." I almost laid that doctor out in the office. When she finally got the diagnosis, he apologized to both of us for being an asshole. Unfortunately, it didn't end well. Even after 8 months of therapy, chemo, and radiation, her cancer came back 7 months later and eventually spread to her brain and spinal fluid. So many people brushed it off with, breast cancer, that's one of the easy ones. My insert relative nobody cares about had it. She even switched gynecologists twice because they wouldn't take her symptoms seriously. It's been 6 months now, and not a single day goes by where I don't wish I could have taken that cancer from her. She was only 27 years old. To everyone wondering how I'm doing, it's been 6 months since she passed, though I had been grieving for a while before that. Anticipatory grief, they call it. So, all things considered, I am doing well. Her birthday was on February 28th, and she would have been 28, so the week was quite solemn. Other than that, I've found ways to move forward with her, not from her. Whenever I have a moment of sadness, I let it happen and then continue. I do have PTSD from her time in the hospital, but I'm learning to manage it. And when COVID calms down, I plan to start therapy. Overall, I am doing well, enjoying life as much as COVID allows, and processing my feelings. I miss her every day and will for the rest of my life. Eat it. A few people have suggested I sue the doctor, especially considering the cost of treatment. I live in Berlin, Germany, and despite that unfortunate initial misdiagnosis, her treatment and care afterward were excellent. She received care from the Charité Berlin, one of the finest medical institutions in the world, and thanks to our healthcare system, we haven't paid a dime for any of her treatment. It's been a while, and I am at peace with everything. I don't plan to pursue litigation or sue a doctor for something that happened in 2019, though I understand your concerns. Story 27. I'm the patient in this story. When I was a toddler and started walking, my extended family noticed that I waddled a lot. My parents didn't really notice because they were used to my funny walking, but my grandma and aunts, who saw me less often, insisted I had a limp. My mother asked our pediatrician about it, and he reassured her that it was nothing and would correct itself as I grew. A year passed, and it didn't improve. It actually became more noticeable. My mother asked the doctor again and requested an x-ray to make sure everything was okay. The doctor snapped at her for wanting to expose me to radiation, insisting it was nothing, but he referred us to a specialist anyway. The specialist suggested that my parents wrap some wool around the leg that had the limp, claiming it would warm it up and speed up the growth process. Right. My dad finally had enough. It was summer, and my regular pediatrician was on holiday. His partner saw me instead because by that time the limping had become really bad, and my parents wanted another opinion. The new doctor measured my legs and found a 4 or 5 centimeter difference between them. I was sent to a specialist children's hospital to get it fixed immediately. I had severe hip dysplasia, so severe that my right hip didn't have a socket for the femur. After 3 years and 3 surgeries, plus months of physiotherapy to relearn how to walk, I was normal. If the second doctor hadn't caught it, I would have grown up disabled. He later split from his work partner, the first doctor, and now the second doctor is my daughter's pediatrician. Story 28. I am not a doctor, not even a nurse. While working as a CNA on an ICU step-down unit, I noticed my patient was acting strangely. I asked her a few questions, but her answers were odd. She could barely respond beyond huh and uh-huh. Her gait was unusual, more of a trot than a normal walk, and she was leaning. I was training another CNA at the time and told them, no matter what you do, if you see something, notify the nurse and document that you did so. The patient was having a major stroke, and the nurse was too distracted with her phone to perform an assessment. The woman had to go to rehab and wasn't a candidate for any stroke-reversing treatments, even though I had charted that she seemed off 8 hours earlier. The only reason it was caught was that the night shift nurse insisted on bedside report. The nurse I had been working with yelled at me, "Stroke?" as if I hadn't been notifying her of symptoms all day. Edit. Thanks for all the kind comments. Just remember to be kind to your local CNAs and try to respond to some of those call lights. You'll never know how much we appreciate and respect you for helping with the basics. I'd also like to add that, in theory, anyone can call a rapid, but not every institution supports the policies they claim to have. As I commented below, at this same hospital, I had a patient with a blood sugar in the 30s. I could not get a hold of the patient's nurse or the charge nurse, so I called the rapid response. I was scolded for not giving the primary nurse the opportunity to treat the patient first. I had seen this kind of scolding at least 4 times before this incident, so the clear message was that if a nurse doesn't call it, and you do, you'll be pulled aside and reprimanded. It was a pretty terrible hospital, and I no longer work there. Story 29. Medical student here, will be a doctor in May. During an ED shift, we encountered what was likely a missed testicular torsion. The previous doctor had told the patient he probably had cancer. When he arrived at our ED, it was likely a dead testis that had been missed weeks earlier. People with testes, especially young men, if you experience sudden, severe pain, sometimes without any obvious cause, often during or after activity, go to the ED immediately. It's one of the few things that would make a urologist lounging at home on the weekend turn on his Tesla ludicrous mode and go plaid to get to the hospital. Story 30. I'm the patient in this story, but I still think it's worth sharing. I started having horrible ankle pain when I walked in grade school, and my doctor always said it was growing pains. I knew that was nonsense, so I kept pushing him about it. After multiple attempts at diagnosis, everything from knock knees to pigeon toes to just being weak, I finally went to a specialist. He asked me to flex my ankle, and I did. No, all the way, he said, even though I was flexing as hard as I could. I could only move my foot about an inch from its resting position. It turned out I had extremely limited mobility in that joint due to shortened tendons. He diagnosed me in 5 minutes, after years of my concerns being brushed off. After a few months of physiotherapy and a shoe insert, my pain improved dramatically. Story 31. I'm a dentist in the UK. While working as a locum in an emergency clinic, a man came in with widespread oral infections. He had wanted dental implants and had visited a private UK dentist who refused to perform the procedure due to his heavy smoking and poor oral hygiene, which would limit the chances of success and proper healing. The patient did not accept this, so he went online and found he could travel to Hungary to get the implants done for half the price and enjoy a holiday at the same time. He came back, and within a few weeks, most of the implants were infected. We gave him antibiotics to clear the infection, but then had to inform him that the implants would need to be removed and that he would have to see a specialist dentist with the proper equipment to do so. He was not happy. After spending all that money, he now had to pay again to have them removed. He was no better off and at least £10,000 down. He should have listened when the first dentist told him no. Story 32. I'm not a doctor, but I'm a registered nurse. This happened to me, though it isn't nearly as severe as most of the stories here. When I was in college, I reached the point where I couldn't swallow. It started with mild difficulty, then progressed to having to swallow bites of food multiple times or regurgitating them, until all I could manage were broths and mashed potatoes with no chunks. I went to the doctor multiple times and each time was told it was acid reflux and part of my anxiety disorder. I lost 30 pounds. I had only weighed 120 when this started and was generally miserable. Finally, my grandma got tired of watching me be sick all the time and called the GI doctor herself. They said we needed a referral, but after explaining the situation, they got me in the next day. An endoscopy revealed that my esophagus was 95% blocked at the gastroesophageal sphincter. For some reason, notes from some of my primary doctors ended up in my discharge paperwork. One had told them it was just acid reflux and that I was being overdramatic, and she stated she did not recommend the procedure. Needless to say, I switched doctors. That year was not fun. Story 33. I'm a dental assistant, and a patient came in who looked off. His jaw hurt and he had a toothache. He had just come from the doctor who told him to see us. I suspected a heart attack. I put a pulse oximeter on him and nearly fainted myself. His oxygen was only 82%. I grabbed our emergency high-flow oxygen, yelled for the AED, and called 911. He was indeed having a heart attack. He survived and later brought me a large heart-shaped box of chocolates for Valentine's Day. I've never been so scared or so intensely concerned for another person. The dentist I worked for called the MD and said, "My 25-year-old assistant just saved your patient's life." Story 34. I am a psychiatrist and I am often frustrated by the lack of care some patients receive from other doctors. Emergency rooms can be the worst, especially when staff are trying to move patients through to psychiatric admissions as quickly as possible, sometimes neglecting basic aspects of care. Not every ED doctor is at fault. Some are remarkably thorough and attentive, but these lapses happen far too often. Probably the most egregious incident occurred a couple of years ago while I was on overnight call at a VA hospital. It started with a relatively routine call requesting a transfer of a patient to our psychiatric unit from a community hospital emergency department for treatment of psychosis. He was an older man, I believe in his early 70s, who had been acting strange and delusional. His son-in-law told the ED staff that he had a history of psychiatric issues. I asked them to fax the transfer packet, which included a bundle of assessments already performed, and began reviewing his chart in the meantime. What I found was that he had not actually been admitted to a psychiatric unit. He had been seen by the psychiatry consult team for delirium, while admitted to the medical floor for decompensated heart failure. For those unfamiliar, delirium can occur during any severe illness when the brain isn't functioning properly due to physiological stress. It may appear as confusion or disorientation, but can also include delusions and hallucinations. From his chart, it was clear he had no primary psychiatric issues. He had only been seen while delirious. I received the transfer packet for this patient and immediately noticed major gaps. Not only had there been no cardiac workup for a man with a known history of heart failure, there were not even any vital signs recorded. The only labs included a complete blood count, which was largely unremarkable, and electrolytes and kidney markers. The chemistries were mostly normal, but his blood urea nitrogen was slightly elevated. An elevated urea nitrogen can indicate poor kidney perfusion, as the kidneys reabsorb urea to conserve water when the body is dehydrated. Dehydration or low blood volume is one possible cause, but reduced perfusion can also occur in uncontrolled heart failure. I called the outside emergency room and told them I would not accept the patient onto our psychiatric floor without at least a basic cardiac workup. I explained his history, emphasizing that his psychiatric symptoms occurred only in the context of delirium from heart failure, and that the limited data they had sent supported this. They said they would obtain the labs and vitals I requested and get back to me. I heard nothing further and assumed they had identified evidence of cardiovascular decompensation and transferred him to the medical floor instead. A couple of hours later, I was called to the ED to evaluate someone. While at a computer at their desk, I overheard an ED doctor mention a patient coming in from the same hospital. For context, transfers to the VA pass through the ED first, even though this is technically not allowed at other hospitals. Curious, I asked if it was the patient with decompensated heart failure. I was told it was the same man and that he had been actively having a heart attack in their ED. Needless to say, I was extremely upset that the outside ED had attempted to send him to our psychiatric unit, where access to other medical treatments is more limited, without even taking his vital signs or recognizing the heart attack. I tell this story to medical students rotating through psychiatry to emphasize that just because someone is acting bizarre does not mean you can label them a psych patient and ignore other serious medical issues. Story 35. Another not a doctor story, but my mom is a nurse. When I was 15, I fell on my wrist during PE at school. The school nurse, who knew my mom through nursing circles, said to just keep an eye on it. Later that afternoon, I was in agony, but my mom insisted I was old enough to cycle to the doctor myself. After enough whining, she finally took me, and the hospital confirmed it was broken. She sat very sheepishly in the waiting room after hearing the diagnosis. Fast forward 3 years. My stepbrother came home from university for the weekend with a sore wrist from a fight. Same response from my mom. Quit whining. It's fine. He went to the university health center after returning and was taken to the hospital for surgery and a pin to be inserted. Edit. To address comments about her being a bad mother or nurse, far from it. She's been a fantastic grandmother, and is highly regarded locally for her nursing. But as other children of medical professionals have noted, something seems to switch off when it comes to their own kids' medical issues. I've met many people with similar stories, and it's been nice to share and laugh about them. Story 36. I'm the patient, but this is an important story to tell. From around the age of 17, I began experiencing daily abdominal pain and severe digestive problems. I could barely eat, and my bowel habits fluctuated between diarrhea and constipation. My menstruation became increasingly painful, and I started losing enormous amounts of blood despite being very small, less than 5 feet tall. You would think any competent doctor could recognize this as a gynecological issue. However, my doctor at the time, a woman, insisted it was anxiety and said she wouldn't bother testing for or treating a gynecological problem unless I was older and trying to conceive. Over the next several years, my gastrointestinal and gynecological symptoms gradually worsened. I was referred to dozens of different specialists and repeatedly told it was just stress or anxiety. Questions ranged from, "Are you pregnant?" to incredulous, "Are you sure you're not pregnant?" I was also told that every woman has painful periods, or it's just constipation, take this over-the-counter product, and so on. Meanwhile, my gut function was failing. A functional gut test took 6 hours to pass an egg sandwich when it should have taken 90 minutes. I weighed only 40 kilograms. It got so severe that I even started losing bowel control. No treatment seemed to work. By the age of 24, I was unable to work because I could not control my bowels. Doctors suggested I seek therapy and implied that I might be exaggerating my symptoms. One day, I saw a new GP for routine sexual health tests and received an abnormal pap smear. Within 2 weeks, I underwent an exploratory laparoscopy to rule out cervical cancer, only to discover I was riddled with endometriosis on my bowel, cervix, perineum, some ligaments, and even my gallbladder. I also had an ovarian cyst the size of a tennis ball. After excisions and treatment, my gut function returned within 3 months. Unfortunately, I will never be able to have children. If the doctor I saw at 17 had simply done her job, I would not have lost 7 years of my life, my gallbladder, my fertility, and my mental health. Story 37. Not a doctor, but I had a half-hearted dentist. I went to the same dentist's office for several years and was repeatedly told to get braces and have my wisdom teeth removed. Both of these posed problems. I play the trumpet professionally, and performing at that level is extremely difficult, or impossible, with braces, and having my wisdom teeth removed would take me out of work for at least a month. I told the dentist this at every visit. I decided to get a second opinion from an oral surgeon. They took x-rays and reviewed my records from my dentist. The conversation went like this. Oral surgeon: so, you're experiencing a lot of pain in your wisdom teeth, according to your records. Me: I am not, at all. I never have. Oral surgeon: so, I'm just going to assume your regular dentist falsified the rest of your record, put this folder down, and do my job. The oral surgeon then explained that the way my wisdom teeth had come in, they were sitting on a nerve that would be nearly impossible to avoid during removal. Cutting it could result in permanent loss of sensation in the lower half of my face, a major problem given my career as a professional trumpet player. I was advised that if the wisdom teeth weren't causing pain, there was no need to remove them. However, I did need to extract a tooth adjacent to one of my wisdom teeth, which my regular dentist had completely dismissed when I asked about it. I never went back to that dentist and will be starting with a new one soon. Story 38. I started taking my daughter to the doctor for abdominal pain when she was 12. The pain was excruciating. She couldn't function. We tried tracking her pain cycles, but nothing seemed to make sense. Doctor after doctor, specialist after specialist, told her it was all in her head. This, on top of everything else she was dealing with, led to serious mental health issues. At 19, she ended up in the ER again for abdominal pain, and they discovered a cyst on her ovary. A few weeks later, she was scheduled for surgery to remove it. The procedure lasted a couple of hours longer than a typical cyst removal, and the surgeon, a gynecologist, came out and said, "That is the worst case of endometriosis I've ever seen in my entire career." By 21, after exhausting all avenues for controlling her endometriosis, she had a full hysterectomy. Even during preparation for the surgery, nurses and anesthesia staff were told this was one of the worst cases the surgeon, who specializes in endometriosis, had ever seen. I desperately want to go back to all the doctors and ERs we visited and say, look, she wasn't faking it. I hope that by sharing her story, the next child won't have to endure what my daughter went through. Story 39. Not a doctor, and this is about my husband. After we got married, we struggled greatly and nearly divorced because he would go through phases where he seemed like a completely different person. I had noticed some of this before marriage, but when I stopped working, it became clear that he was really struggling. He had faced many problems throughout his life, beginning with receiving a felony in middle school. By his early 20s, he was in prison for drug use, burglary, reckless driving, and other offenses. He received several diagnoses, including narcissistic personality disorder and sociopathy, but he was never properly treated or medicated. One doctor even told him he was untreatable. Despite this, he got out of prison, stayed sober for years, earned a bachelor's degree with honors, and moved to a new city. Unfortunately, he began struggling with alcoholism again before I met him, and we partied heavily at the start of our relationship. Fast forward a few years, we were married, mostly sober, and living in a new city. And my husband would periodically act completely unlike himself for about 2 weeks at a time, then return to normal. I started charting his behavior and the things he said because he would insist, "I never need more than a few hours of sleep, babe." And then 2 weeks later say, "I always have a hard time getting up in the morning, babe." I still had my DSM-4 from when I was a psych major in college, so I began comparing his symptoms to bipolar disorder. He met nearly every criterion. I convinced him to start therapy and, bingo, he was diagnosed with bipolar disorder within a few sessions, especially once the therapist reviewed his history. Even then, everyone was reluctant to prescribe him medication. An entire year went by, and he was still really struggling. Then he went into a full-blown manic episode and started saying he felt like he could not control himself. That was the point when I took him to the emergency room. In the emergency room, I told the doctor I wasn't leaving until my husband received medication. He was clearly suffering and needed help immediately. The doctor not only agreed completely, she even called his therapist and lectured her for not doing more to get him the medication. He was prescribed a hefty dose of Seroquel, and when we went home, he slept for 2 days straight. When he woke up, he was back to his normal self. It took another 2 years of trial and error to get his medication balanced, but the difference has been incredible. My husband had been considering surgery for excessive sweating, but that problem disappeared once he started Seroquel. A long list of other issues: rapid heart rate, insomnia, difficulty maintaining weight, nausea every morning, and more also vanished once his mental health was treated. Even his alcoholism disappeared. He now struggles to finish a single beer and rarely even opens one. Now, he is essentially as normal as someone without mental health issues and often wonders what his life would have been like if he had received proper help at so many different points. Without medication, he never really stood a chance. Even once we knew what was wrong, I can't help but think about that year of our lives, when we nearly divorced and my own mental health was spiraling. If he had received medication right away. I understand that mental health can be complex, but his struggles were repeatedly brushed aside by numerous mental health professionals, causing unnecessary suffering for both him and our family. Story 40. A patient came in with what appeared to be a fungal infection in the chest. Despite multiple courses of itraconazole, the plaque continued to grow. The physician called me to review the case. On examination, the chest plaque was strongly suggestive of a fungal infection, and direct testing confirmed the presence of the fungus. However, the treatments were ineffective. When I reviewed the patient's records, I noticed that his leukocyte count was extremely low. A quick HIV test confirmed the patient had AIDS, in addition to the fungal infection. To the physician's credit, he had followed proper procedure, even though the patient initially lied on his clinical exam, claiming he had no active sexual life. Once confronted with the evidence, the patient admitted he frequented sex workers and was active in online dating. Public health authorities were not pleased. Story 41. While I was on a trauma and orthopedics rotation at a small hospital with a somewhat unreliable A&E department, the medical team asked me to review a 67-year-old woman who had fallen at home. She reported shoulder pain. A&E had taken x-rays, ruled out a broken collarbone and shoulder, and referred her to the medical team to investigate the cause of the fall. She was still in pain, and the medics didn't fully trust the ED assessment, so they asked me, the chubby but mostly competent trauma and orthopedics SJO, to take a look. I reviewed the x-ray first, nothing broken. Then I saw the patient. Her shoulder was bruised but had a good range of motion. As I palpated the area, I felt some unusual lumpiness under the skin, almost like bubble wrap. I immediately thought, holy shit, this is surgical emphysema. I went back to the x-ray, checked the small portion of lung visible, and noticed a large pneumothorax, punctured lung, and possible broken ribs. The patient received an emergency chest drain and was transferred to a trauma center. She survived. I don't think the ED doctors had even examined her physically. They had just looked at the x-rays and referred her on. Note, surgical emphysema is air-trapped where it shouldn't be. In this case, in the skin and subcutaneous tissue, usually due to a hole in the lung. Story 42. I'm a physical therapist. Just yesterday, I tried to see a patient around 9 a.m., but he needed a blood transfusion. We chatted briefly, and I told him I would come back later. When I returned at 11:30 a.m., he was full-on belly breathing, extremely lethargic, and unable to communicate like he had before. I mentioned it to the nurse, who said she was aware but hadn't checked on him. I came back again at 2 p.m. and learned that an hour after I raised the concern, they finally recognized he was having a reaction to the transfusion and stopped it. By the end of the day, he was being sent to the ICU. Story 43. My wife has severe celiac disease and gastroparesis. She complained of stomach pain and digestive issues for years, but her parents and doctors dismissed it, chalking it up to her being a drama queen, which she definitely was not. She has always been one of the most level-headed people I know. She wasn't diagnosed or treated until she was 21, by which point her body was essentially shutting down and eating itself because it couldn't process nutrients. Now, in addition to celiac disease and gastroparesis, she suffers from numerous food allergies, autoimmune issues, cysts, and decreased fertility. All of this happened because no doctor was willing to spend 10 minutes listening to a teenager with consistent symptoms. I love her family, but it infuriates me that her mother tries to downplay how much she ignored my wife. Story 44. Not a doctor, but a physician brushed off my knee pain. I had been tossing a frisbee, jumped to catch it, landed on a hill, and heard a loud pop. I couldn't really walk on it. I waited a couple of days for the swelling to go down, and by then I could walk again, though something still felt off. I went to a doctor who did a strength test and said it seemed fine. I convinced myself I must be overreacting. 5 years later, after tweaking my knee during a mud run, I finally saw a doctor again. They ordered x-rays and an MRI and discovered I had torn my ACL. Because the injury had likely happened years earlier and I had not received physical therapy or surgery, my knee had additional damage, a torn meniscus, and a divot in my femur. Years of continued activity had worn down my cartilage, leaving bone-on-bone contact. Story 45. I'm sharing this again because I hope it helps someone. When I was 26, I found a lump in my breast. Thanks to Planned Parenthood teaching me self-checks, I knew it felt different from a cyst. It felt exactly like the tumors I had been taught to recognize. The first doctor dismissed me saying, "You're too young for breast cancer." I didn't accept that and went to a second doctor who said, "It hurts when I press it, right?" "No." "It gets bigger with your period, right?" "No." "Sure it does." The third doctor said, "You'll have an ugly scar if I biopsy it." By the fourth doctor, I told him to call the police to remove me from the table if he wouldn't schedule a biopsy, because I was not leaving without one. It turned out I had stage 2 breast cancer. After surgery, 9 months of chemotherapy, 3 months of radiation, and being told I couldn't have children, I survived. I now have 3 children and am 62 years old. If something feels wrong, trust your instincts. Seek second, third, or even fourth opinions. Don't let anyone dismiss your concerns. Story 46. Not a doctor, but I've had migraines for years. They were mainly behind my eyes, but I assumed they were due to stress and hormones. So did the neurologist I first saw. She seemed annoyed when I described the pain behind my eyes, in my temples, and the intense pressure. She prescribed Imitrex and sent me on my way. Later, during a routine eye exam, my ophthalmologist asked about headaches. I explained that I always seemed to have them. She noticed that my optic nerves were very inflamed and explained that excess spinal fluid or a tumor could be the cause. She referred me to a neuro-ophthalmologist, where I underwent a brain MRI, a spinal tap, and was started on medication to regulate my spinal fluid. The neuro-ophthalmologist said I was about 6 months away from permanent vision loss. After the spinal tap, they removed approximately 100 cubic centimeters of fluid and measured my pressure at 42, whereas normal spinal pressure is 8 to 16. I was lucky I mentioned my headaches to my eye doctor, a big middle finger to the neurologist who had just handed me medication. Story 47. I was actually the patient. Last year, in 2019, I noticed a small lump growing on my arm. At first, it was the size of a mosquito bite, but within a month or so, it grew to the size of a marble. I come from a country with a lot of sun, but I had moved to one with very little. Every time I went home, I went to the beach. One time, I got a sunburn, and when I noticed the lump, I started to worry it might be skin cancer. From the pictures online, it certainly looked like it. I went to the doctor who said it was a cyst. I asked if he was sure, and he gave me a cream and sent me on my way. A couple of days went by with no change, so I went back and told him the cream wasn't working. He sent me for an ultrasound. The results showed it looked like a cyst from the outside, but inside it was different and didn't behave like one. He suggested I get it removed, warning that it would leave a large scar on my arm. I decided to get a second opinion, especially since I had a flight booked to my home country for my birthday. I told him I would let him know later. Once I was home, I saw a doctor who examined the lump and told me he thought it was skin cancer and that we needed a biopsy. It was skin cancer. I had surgery about a week later and went back to the doctor to confirm the diagnosis. He was very surprised, but I didn't end up with a large scar on my arm. Story 48. I have a story that goes in the opposite direction. A woman came to the emergency department with extreme fatigue and spontaneous bruising. Labs showed low white blood cells, red blood cells, and platelets. Without doing any confirmatory tests, she was told she had leukemia and would need chemotherapy. She was admitted to my service, crying and terrified. After taking more history, we learned she had just started a medication for her rheumatoid arthritis that can cause low blood and platelet counts as a side effect. Further workup found no evidence of leukemia. The medication was stopped, and within a week, she was completely back to normal. Story 49. Not a doctor, but my wife is a nurse practitioner. She saw a patient at an urgent care, did some nurse practitioner things, an EKG, I think, and told her she needed to get to an ER because she likely had blood clots that could cause a stroke. She needed a test that only a larger hospital with better equipment could do. The woman left, and a few days later, my wife decided to check in on her by phone. She was surprised to hear that the doctor had sent her on her way and wasn't too concerned. My wife expressed her worry, and the woman couldn't sleep that night thinking about it. She got up and went to the ER. It was a different doctor, but the same ER. And when they ran the tests, they found 3 blood clots. She went into surgery immediately. She called my wife afterward to tell her what happened and to thank her. I'm so proud of my wife. She's only been an NP for 1 year, and I always knew she'd be great. She's excellent at her job, which is why it amazed me that it took her a year to find an NP position after graduating. She was an excellent nurse. Honestly, the best in my opinion. She cares deeply about people and is the best mom any kids could ever ask for. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.